Hello and welcome back to a new video. So here we will talk about the symptom progression of hernia. First, it is very important to mention that the symptoms of hernia are quite the same between women and men. And also, it is important to explain what hernia really is. So hernia occurs when there is an internal organ inside the abdominal cavity or a fatty tissue inside the abdominal cavity that protrudes outward through the abdominal wall. And for it to do that, there has to be a weakness in the abdominal wall that allows that organ or the fatty tissue to go through that wall. And this will produce different types of symptoms that we will talk about in this video. So the first symptom of hernia is that a visible bulge that can be seen only when coughing or straining, and it goes back to normal afterwards. Meaning there is a bulge on the abdominal wall like this here, and it only seen when the person coughs or strains their abdomen. Examples for straining is that when lifting weights or when defecating or urinating. And this bulge goes back to normal when the person relaxes again. Now you might ask where this lump could be on the abdominal wall. And the answer for that is that it could be anywhere on the abdominal wall. Generally speaking, there is an inherently weak spots on the abdominal wall. Those include the epigastric, the umbilical here, the inguinal and femoral locations. And there is weak spots that develop over time, like when there is a trauma to the abdominal wall, and when there is a surgery on a certain part of the abdominal wall, it might turn into a hernia that's called incisional hernia. The other question you might ask is, what could be inside this bulge? The most common contents of the hernia are the intestine and the omentum. The omentum is a fatty tissue that covers the stomach and the intestine, and it could come to the bulge with the intestine together. There could be also any different organ like the fallopian tube or uterus in women, or the stomach, and so on. Now we already mentioned that the first symptom of hernia is that there is a bulge, and it only comes when the person contracts their abdomen. Now the first progression of this symptom is that this bulge becomes more visible, and it has to be pushed back to get reduced. So this time the bulge becomes more visible, and to be reduced, the person has to push it back into place. And the person feels pressure at the affected area. So here is example that the person is pushing their bulging hernia to its place. So after that comes the second progression of hernia, and that is the visible bulge can't be reduced back anymore. It becomes reducible or incarcerated. So the visible bulge is now always visible, and when the person tries to push it back, it won't come back. It stays the same. And there is more discomfort at the area. There is also pain, and it is usually mild discomfort or mild pain. It might be associated with bowel obstruction. So the bowel that is inside the bulge become obstructed, and this would give symptoms like nausea and vomiting and constipation because the food can't move through the bowel. So it is either coming out of the mouth, that is why there is vomiting, and there is no feces forming, that is why there might be constipation too. And treatment with surgery is urgent. Urgent means that it has to be done, but it could be delayed a little bit until more qualified team comes to the hospital. So after that comes the third progression of hernia, and that is when the irreducible hernia becomes strangulated. And by strangulated, this means that the blood supply to the hernia content becomes compromised. And now the arteries and veins that comes to the bulge content are blocked too. So there is no blood reaching this area. And this leads to onset of burning or sharp pain. And there's a swelling. So as you can see here, there is an umbilical hernia and it is swollen and redness, and even the area around it also red. And there is nausea and vomiting and constipation because of the bowel obstruction. And there is also fever, and treatment with surgery is emergent. Emergent means the surgery has to be done right now. And if not treated, then the content of the hernia become infarcted and die, and this leads to peritonitis. This is an example of umbilical hernia. It is red and swollen. And with that, we're at the end of this video. Thank you guys for watching. Please make sure to like and subscribe. And if you want to support more, you can by subscribing to the Patreon. Link provided in the description of this video. Thank you for watching and peace.